Hi, I'm Michelle Grazoulis, and I'm president of the foundations at Rochester Regional Health, and I'm here today joined by Dr. Nana Duffy, who's a dermatologist at Rochester Regional Health. Dr. Duffy, thank you for joining me.
Thank you. This is so fun.
It's nice to have
Glad
you
to
here.
be here.
So today we're here to talk about skin health. And as always, I invite the audience, listening audience, to ask questions. Please submit them, and we'll take a break and make sure we get your questions answered. So I want to start with a pretty simple question. What are some of the most common skin conditions that you see, especially when the weather and the seasons change?
Okay. So this time of year, this is kind of like nummular dermatitis season.
Nummular?
Right.
Okay.
So
It's a new
nummular
word.
nummular means coin-shaped.
Okay.
And so this is the time of year that we see this rash where people come in with these round coin-shaped rashes, generally pretty itchy, on the arms and legs, sometimes on the trunk. It's very, very common. And we see it in droves this time of year.
Because of the dry season?
Basically, it's a lack of humidity, lack of sunshine, and lack of moisture. So some people, mostly on the male side, tend not to moisturize their skin a lot. And so this time of year, and even going into the winter a little more, it catches up with you. The skin dries out, it lacks moisture, and then it starts to get inflamed and itchy.
So that's what you're seeing most frequently now.
This is just the start of nummular dermatitis season.
Okay.
Yeah.
What are some, before we jump ahead, so what are some of the other things that are sort of seasonal specific that you end up seeing?
Lots of poison ivy in the spring and summer because people are out gardening and, weeding and things like that. We do full skin checks all year round, but we probably tend to see more of it at the end of summer or in the fall, because patients kind of accumulate their sins, out in the sun, and they get worried about their, something on their skin that might be changing. So,
yeah, and you notice it more when you're in, sleeveless t-shirts and shorts.
True.
And all of a sudden you say, oh, well, that wasn't there before.
True. Psoriasis is also more common in the winter time. So we tend to see psoriasis flares in the fall and winter because of lack of sunshine and lack of humidity.
So I didn't realize that psoriasis was positively impacted by sunlight.
Most skin conditions, with certain exceptions, lupus, skin cancer obviously, and anything that's precancerous, but most inflammatory skin conditions actually get better with sun exposure. Not that we recommend patients to specifically seek out sun exposure to make their skin better, but it generally happens that way.
So given that, I never even thought about that, but given that, there must be dermatologists in the Northeast or in the colder climates or seasonal changing climates must have differing practices than those maybe in the warmer or sunnier climates.
Well, I think we tend to see that seasonal variation of certain conditions, whereas maybe down in the South, where you have many more months where there are UV rays, you maybe won't.
Yeah,
but
it's really interesting. So I want to ask you some specific questions about certain skin conditions and how you treat them. So let's start with eczema as the first one.
Sure.
So what's the sort of way that people can combat that or treat it as it's happening to them?
So eczema, for the most part, is considered a genetic condition where people have a deficiency in the skin barrier. And what that means is the ability of your skin to keep things that are supposed to be on the inside in and keep things that are supposed to be on the outside out.
Oh, interesting.
So when you have a defect in that skin barrier, you can almost imagine it like a very nice, tight layer of bricks and filled in the middle with mortar. So when you have eczema, that mortar in between the bricks of your skin cells gets lost. So it's important to replace that from the outside with a moisturizer that contains ceramides.
Yep. My son had it really terribly as a young kid and or baby, and had two big circles on his cheeks that were just red constantly.
Right. Yeah. So interestingly, children tend to get eczema on the faces where adults tend not to.
Interesting.
Yeah.
And I also remember the pediatrician telling me that eczema, asthma, and there's a third.
They run together.
Yeah.
Seasonal allergies, hay fever.
Yeah.
Also, so that's a cluster of disorders called atopy, and keratosis pilaris is actually included in that group.
So interesting.
So
Okay.
there's a cluster of diseases that tend to run together. You see them cluster together in the same family or even in the same person.
Interesting. Okay, dermatitis. Explain to the listening audience, what is dermatitis?
Well, dermatitis is actually just a very general term. Eczema is actually a type of dermatitis. We call it atopic dermatitis. Nummular dermatitis that we already spoke of is a type of dermatitis. But dermatitis is basically just a very general term that means inflamed skin.
Okay.
There's probably 25 different types of dermatitis. So it's just kind of a general term, and you separate it into its proper category based on what it looks like, what it's caused by, what type of person has that dermatitis, what they've been exposed to. Contact dermatitis would be a type of dermatitis. So that's like, poison ivy.
Yeah, okay. So inflammation of some sort.
Sure.
Rosacea.
So this is one of my most fun conditions to treat because...
I saw her smile.
So most people don't know this, but the root cause of rosacea is actually a tiny microscopic bug called Demodex that lives in your follicles. And the really amazing thing is that Demodex are normal inhabitants of our skin. So if I took a biopsy, Michelle, of your eyebrow, I might find a couple of Demodex mites hanging out there.
I don't know why that.
So most of the time they're commensal organisms. They're supposed to be there. They're there in low quantities, just kind of hanging out, doing their thing on our skin. When you have rosacea, you have a defective innate immunity. So the immune system that lives on your skin is defective and allows for those mites to populate. So you have
overpopulate.
Correct. You have many more than you should, and they create inflammation
So
on
you
the
treat
skin.
that topically, or is that treated orally?
We can do both.
Okay.
But sometimes what I do when I have a patient is we can actually scrape the skin and look under the microscope and see those Demodex mites live under the microscope. And
it is unreal to think about.
Yeah, so it's but it's kind of nice because sometimes patients really want to understand, why do I have this? And if you can show them the root cause and then treat the root cause, it actually, I think, in the long run makes them feel better.
Well, yeah, and it's natural, and the reality is that those bugs should be there.
Yes.
Right? Because our skin is our largest living, breathing organism in our body.
Yeah.
Organ in our body.
That's
okay,
true.
last one I want to ask about is dandruff.
So dandruff, so we call dandruff seborrheic dermatitis. That's another type of dermatitis.
Okay, got it.
Seborrheic means waxy or greasy.
Okay.
So seborrheic dermatitis is just a fancy word for dandruff.
Okay.
And we see it obviously commonly on the scalp, but we also see it on the face a lot of times.
Okay.
And so people get these rashy areas on the eyebrows or the crease of the nose, sometimes around the mouth. And that condition is actually caused by a yeast called Malassezia, which also is normal to have in small quantities on the skin, but just not normal to have in large quantities.
Okay.
So we generally treat that with anti-yeast medicines.
Okay, we're going to talk about acne in a minute.
Sure.
So I want to ask about that, but I want to talk about that as a larger topic.
Sure.
So I guess my question, as it relates to all those skin conditions, is when someone recognizes that something's off with their skin, kind of what's the first thing they should do? Call their primary care, make an appointment with a dermatologist. I always like to give the listening audience kind of a, what do I do?
Yeah, that's a good question. Dermatologists really are the specialists when it comes to skin and hair and nails.
Okay.
And those are a couple of items that sometimes people forget, is
we
that
never
we're
have-
really the go-to doctors when it comes to hair disorders or nail disorders, as well as skin disorders.
I've seen a dermatologist my whole life, and I would never have thought of that as an area of specialization, if you will.
Yeah, so
Interesting.
So, I think as long as your particular plan doesn't require a referral, there's no reason that you couldn't go straight to a dermatologist if you if you had a skin, hair, or nail concern.
Okay.
Now, many of the primary care physicians, the internal medicine doctors or family doctors are wonderful at treating, basic, common skin disorders. So it wouldn't be wrong to go to your primary care doctor first, and if it's something that they are unsure about or need a second set of eyes, they'll send you over to us.
That's great. Okay, so we covered sort of the things that you see. We're going to talk about acne in a minute, but I want to start with just talking about so many of us are focused on making sure that we're taking good care of our skin. So what are some of the non-medical things that you can give us some advice on to improve the quality of our skin?
Okay, so the number 1, 2, and 3 answer has to be sunscreen, sunscreen, sunscreen. Even in the fall and winter. There's so many reasons that it's important, but number 1 is that it is proven that using sunscreen on a regular basis decreases your risk for skin cancer, and not just the common non-concerning types of skin cancer like basal cell or squamous cell. We're talking the most dangerous forms of skin cancer like melanoma. The studies have shown that regular use of sunscreen decreases your risk. So that has to be my number 1 answer. And this time of year, I think it's easy to get out of the habit of using sunscreen regularly because the sun isn't shining so brightly all the time. But if you're using a moisturizer that has a bit of sunscreen in it, maybe an SPF 30 would be fine, or your makeup has some sunscreen in it, that's something that is kind of a no-brainer. And you just put it on in the morning and don't think twice about it.
And everywhere? I'm looking at you and I say, okay, so would you recommend sunscreen on your arms? Is our face pretty much the...
Yeah, good question. So I have an SPF 15 right now in my makeup, and I basically wear this every day, even if I'm going to be inside at work for most of the day. 80 to 90% of skin cancers will arise on the head or neck.
Yeah, which makes sense.
Okay, so we really try to be reasonable with our patients, and if you have somebody that's not a regular sunscreen user, I'd rather them put sunscreen on their head and neck. If I had to choose one place,
gotcha.
I would say put it on your head and neck.
And we did a segment a couple months ago on skin cancer, but I think it bears repeating. It doesn't matter how old you are either. We should be, thinking about kids wearing sunscreen as a sort of daily thing, just like you or I would, right?
Correct.
Yeah.
Correct. That being said, your risk of skin cancer later on in life goes up if you have a certain number of blistering or memorable sunburns younger in life.
Yeah.
So it does seem to matter if the skin gets traumatized early in life.
Yeah, it's really amazing. I know I could tell you horror stories about the things we would do when we were younger to get tan.
Oh, I've heard them. My patients tell me all the time.
Oh, I wouldn't tell you. That would just be my little secret.
Okay, fair enough.
But very good advice, and I think it's true. There's so many products out there now, especially for folks, who wear any kind of a foundation, to buy something that has sunscreen in it. So lots of ways to make that easier. But your point's a very good point.
I do want to mention one thing when we're talking about protecting your skin from the sun. So what that means, unfortunately, here in Rochester, New York, is that you're going to be vitamin D deficient.
Yeah.
Okay, if you're practicing regular sun protective behavior, you're going to be vitamin D deficient. And so vitamin D deficiency actually, in turn, can increase your risk for certain other cancers or make your prognosis for other cancers worse. For example, breast cancer. So you just want to make sure that you're getting your levels checked and that you're supplementing your vitamin D levels with either over-the-counter supplementation or, if they're low enough, a prescription from your doctor. And of course, diet as well. So
I just want to make sure I'm understanding that. So that just the sheer act of keeping sunscreen on every day actually does. It's hard to imagine that actually keeps vitamin D out. I get it, because vitamin D is in it's what we produce from the sunlight.
Correct.
Yeah. But so much so that you're saying we really do need to pay attention to that because we don't have ample sunlight all the time.
Yes, especially here in Rochester. Now, if we were in a different latitude, then your risk of vitamin D deficiency would be quite different. But
That's really helpful. I've lived here almost my whole life, but I never would have thought about that being a consideration with sunscreen. Okay, so now we're going to talk about acne.
okay.
So without getting too graphic, because I don't want anyone, or let me actually pause for just a second. Well, actually, I have a question about acne that came in, so I'll ask that question right
Sure.
now. So without getting too graphic, people pick their skin when they have pimples, and I mean, I had terrible skin as a young kid, and both my kids suffered from acne, so I get it. But what's the risk of doing that? Are we creating damage to our skin that is not good?
You just have to do it the right way, and you have to pick the right pimple.
Okay.
Okay. So patients sometimes get these cystic pimples that are way under the skin that don't have a head on them, so to speak. That is not the type of pimple that you want to try to approach.
Okay.
That's best treated with an injection that we can actually give in the office that will cause pimples to go away within 24 to 48 hours. Now, if you have a pimple that's juicy and it's got a whitehead on the top and you just can't stand it, it's okay to pop it. You just have to do it the right way. So what I tell my patients to do is clean the area off with some rubbing alcohol.
Okay.
You take a little sterile lancet, which is actually one of those tools that patients use to prick their fingers when they check their blood sugar.
Yeah.
You can get those from any drugstore. You gently nick the skin on top of the pimple, and then you take a tool called a comedo extractor, which is kind of like a rod with a metal loop at the top, and you put that right over top of the opening that you just made, and you gently press down, and it comes right out.
Yeah.
And after that, you can apply some over-the-counter, salicylic acid or benzoyl peroxide gel, and you'll be good to go.
Okay. Good advice. I wish I had it 25 years ago. So let's talk about acne treatments because, and I know, I had been on Accutane as a young kid, so there's lots of options out there. What are your thoughts? And this isn't a commercial advertisement, so I'm curious about some of the over-counter things that people can buy to use for acne versus actually needing to go in and get prescription medication.
Right. That's a good question. It really depends on the severity of the acne. So if a patient is coming in with very mild, what we call comedonal acne, which means that basically all you have are tiny little clogged pores. And they generally happen in the T-zone, so on the forehead, the nose, maybe the medial cheek, and maybe the chin. So tiny, clogged pores on the T-zone that aren't leaving scars, that's something that could very nicely be treated with over-the-counter products. So you have salicylic acid, which is a keratolytic agent. That means that it breaks up keratin.
Okay.
So salicylic acid basically kind of cleans out your pores. And then you have benzoyl peroxide. So those are two of the main over-the-counter acne ingredients.
And those are in lots of different types of products commercially sold.
So
you want to look for those ingredients.
Sure, generic, Top Care brand, benzoyl peroxide gel, and it'll work just fine. Okay. Yeah. So benzoyl peroxide is a type of a topical antibiotic that's really great
So, Nana, I'm
easy
curious.
to find.
I'm curious what kind of advice you would give, because for teenagers or anyone at that stage in life where acne is just so horrible, when do you know that it's something that you need to see a dermatologist for versus this is just normal sort of age-appropriate acne?
I would say the main indication to come in is if you feel like the acne is becoming a scarring type of process. Right.
Not just physically, emotionally too.
Right. So if you're noticing that the skin is scarring, you're getting brown marks or red marks that are staying for weeks and weeks or maybe even months, that's probably a sign that you should come in and get some prescription products, whether they're prescription topicals or oral antibiotics, because we really don't like to see the skin get scarred, especially in young patients.
Okay, that's really helpful. Anything else on the acne front that you'd want to make sure I mention today?
Actually, there's some new research coming out kind of proving what patients have been telling us for many, many years. And for many, many years, we've been saying to patients, no, it's not important. Go ahead and drink all the milk you want. So there actually has been a new study linking acne and dairy, all dairy. Now, the risk of acne with skim milk is the highest, but there's a risk for all dairy.
Really?
Really.
What is it in the milk?
So one of the thoughts about
This is fascinating.
about why the skim milk is so much worse than the other types of dairy is that when you take the fat out of the skim milk, the companies have to add kind of filler agents to give the milk still that silky mouthfeel, and some of those filling agents can basically spike your insulin levels.
Wow.
So they contain insulin-like growth factors that cause your blood sugar to kind of waver up and down, up and down, up and down, which causes inflammation, and then can trigger acne.
Interesting. So patients for years have been saying to you, I notice I break out. Oh, really interesting.
Mm-hmm.
Wow. That's fascinating. That's really interesting to
Yeah.
learn. Okay, I want to shift topics for just a second to talk a little bit about the sort of the ongoing question of how often should we shower a week? What's good for our skin? You talked about hair. I mean, there's always the ongoing of how frequently should I shampoo my hair?
So I love this question, and I want to know who actually came up with this question.
Phil gets to take the credit for the question.
I think it's a great question. I mean, would you like to tell us how often you? No. Okay.
Every day. And I'm one of those people where I'm like a perfect example of my hairdresser says, you don't need to wash your hair every day. But I'm so conditioned to do it that I do it every day.
Right.
But I love when I don't wash my hair looks better. I'm like, why don't I do this? But
I think
I'm so
it's a
conditioned.
fascinating question, actually. It's part of it has to do with what particular skin conditions ail you.
Okay.
Right? So if you're someone that's prone to dry skin or eczema or atopic dermatitis, especially if you're a child, especially if it's the fall or winter, you maybe shouldn't be bathing every day.
Drying out your skin.
Correct. Or if you do, you have to make sure to use extra moisturizer.
Okay.
Now, the hair question is also patient dependent. So most Black women tend not to wash their hair more than maybe once a week. And if we did, it would actually be damaging to our hair. Okay. So, last night was my hair washing night, and I won't do it again for another week. And that's just how it works for me. So the hair washing is just very much an individual preference.
It's interesting.
Right.
It's always this hotly debated topic, at least amongst the women in my office. Seriously. Phil knows my office, so he knows that we spend a lot of time talking about it. Thank you. That's very helpful. So anything, in your work that you say this is sort of pressing today that besides the milk study, because I want to make sure that if there's any questions that I didn't ask that you say, I think it'd be great for the audience to hear this. Mm-hmm. Anything in particular?
Well, not in particular, but just going back to the question about bathing.
Yeah.
Living in Rochester and having lots of cold days where we have the heat cranking in the house, I think it's important to just be using a very gentle cleanser that's not a traditional soap.
Okay.
Okay. When you're showering in the fall and winter.
So what's an example?
So I'll give you an example of something that you wouldn't want to use on a daily basis. Your Ivory, your Dial soaps, those classic,
cleansing.
Correct, that really strip the skin of its moisture. You're just kind of asking for trouble.
Okay. Dove is a good.
Dove or Dove sensitive skin is even better because it doesn't have the fragrance in it.
Okay.
There's a line called CeraVe, which is easily found. You can get it over the counter very, very easily. And they do make a bar of a cleanser, but it's not a classic soap that's going to strip your skin of all its inherent good moisture.
That's great to know. So the question I always ask all the physicians that I interview: how'd you end up in dermatology?
They were the happiest doctors in the hospital.
Well, there you go. Really?
Really.
Okay. Did you know going into medical school that that's what you wanted to do?
I did not. So I came upon that discovery as I was going through my hospital clerkship. So when you're in your 3rd and 4th years in medical school, you have to follow all of the different specialties around to kind of get a sense of what they do and figure out what you're going to practice in. And I never met a dermatologist that wasn't completely thrilled about their job. So
Interesting.
I guess it started out with that initial discovery,
Yeah.
and then
And it's lived up to it. Has it for you?
Yes, absolutely.
Good.
I feel lucky every day to
That's great.
be a part of it.
That's great.
For sure.
And you've been with Rochester Regional for how long?
For about a year now.
I thought it was just coming up on a year anniversary.
Yeah.
And the best way for people to get connected to dermatologist appointments, are notoriously tough to get because there's not enough, I think, for the number of people. But call our link line to get connected. Is that the best way, or?
That would be fine, or you could call our main office
Okay.
as well, which is in Brighton/Henrietta.
Great. And you're accepting new patients.
We are.
Great.
Yes.
That's great. Okay. Well, listen, I want to thank you very much, Dr. Duffy, for joining me today. We've had a good conversation about skin health, and given it's the season for us to be paying attention to it, we appreciate all the advice. If you have any additional questions, please feel free to submit them, and we will get them back to you. But thank you for joining me.
Thank
It's been
you
great
for having
having
me.
you. Look forward
Thanks
to
a
doing
lot.
it again.
Likewise.
Thanks so much. Have a great day.